Hello, and welcome to today's webcast from the Agency for Healthcare Research and Quality on best practices for conducting SOPS surveys. My name is Lisa Huddleston. I'm a lead research associate at WestET and the communications team lead for the contract that supports AHRQ's SOPS surveys, and I'll be the moderator today. Next slide, please. We have a few housekeeping items. First, if you are having any issues with your computer audio, you can connect to the webcast audio using your phone by clicking on Phone Call to find the dial-in number and meeting ID, or selecting the Call Me option to enter your phone number and receive a call from Zoom. If your computer freezes during the presentations, you can try logging out and logging back in. At any point in today's webcast, you may ask a question through the Q&A icon. We encourage you to share your name and organization or role when you type your question. Speakers will respond to your questions during the Q&A segment at the end of today's webcast. Please note that both the raise hand and chat features are disabled. You can currently download the presentation slides and view the agenda and speaker bios on our event website at https://events.westat.com/SOPS. In addition, a replay of today's webcast and slides will be made available soon on the AHRQ SOPS website. Once posted, you may access the recording and slides at https://www.ahrq.gov/SOPS/events/best-practices-0122424.html. There is only one Zoom link for the entirety of today's webcast. If you leave at any time, you can rejoin using the link provided in the email you received after you registered. Next slide, please. Now I'm happy to introduce our speakers for today's webcast. We're very pleased to welcome Karen Ginsberg, who is the Director for the Consumer Assessment of Healthcare Providers and Systems, or CAPS program, as well as the Surveys on Patient Safety Culture, or SOPS program at AHRQ. I'm also pleased to introduce my colleague, Joanne Sora, a WestET Vice President and the Project Director for the CAPS SOPS project. And again, I'm Lisa Huddleston, and I'll be moderating today's webcast. Next slide, please. Our agenda today starts with Dr. Karen Ginsberg giving a brief overview of the AHRQ SOPS program. Then Joanne Sora will cover best practices for administering the SOPS surveys, submitting to the SOPS databases, and SOPS resources. We will end with a question and answer session. So let's begin, and I will hand it off to Karen.
Thank you so much, Lisa. Hello, everybody. Good morning or good afternoon. And thank you for joining us. So I'm so happy to present the program today on best practices for administering surveys. Today's webcast, we hope, is going to help you get started on conducting a SOPS survey. We hope the webcast will acquaint you with the considerations and the decision points that you will likely encounter and want to think about as you plan to implement a SOPS survey in your facility, either whether you are administering the SOPS survey in-house or hiring an outside organization or third-party vendor to do it. All of what you're going to hear today is spelled out in our SOPS survey user's guide, so you'll have a handy reference as you move forward. And the SOPS program, our technical assistance program, is here to help you. So if at any point you have questions, contact us at our technical assistance email or phone. You'll see those at the end of the webcast today. So feel free to call us with your questions and let us know what's going on. To start the program, though, I'm going to tell you a little bit about the Agency for Healthcare Research and Quality, who sponsors this work and provide background to the SOPS program. Can I have the next slide, please? So the Agency for Healthcare Research and Quality, or AHRQ, is a research-based agency, part of the U.S. Department of Health and Human Services, and we're the lead federal agency that's charged with improving the safety and the quality of America's healthcare system. And as a research agency, AHRQ does not have the authority to require the use of our tools or surveys or to submit survey results to us. If there are requirements for you or options for you to use the SOPS surveys as part of a program, those requirements come from another organization or agency. On the next slide, please. So in our patient safety program, we prioritize focusing on areas of greatest impact, extending patient safety improvements to all healthcare settings, preventing healthcare-associated infections and reducing antibiotic resistance, building capacity in the healthcare system to accelerate safety improvements, improving communication between clinicians and patients, and generally just making the safe thing the easy thing to do. The next slide, please. So the SOPS program has been continuously funded by ARC since 2001. And what the program does is develop validated surveys to measure patient safety culture in facilities using the best methods for development and testing of those surveys. The SOPS surveys are trademarked, which ensures that they have met certain criteria in their development and testing. And in addition to the surveys, the SOPS program also conducts research to further our understanding of patient safety culture and provide tools to improve it. We also operate databases for voluntarily submitted SOPS data and provide feedback reports to the data submitters, as well as a yearly chart book. Next slide, please. So we define patient safety culture as the beliefs and values and norms that are shared by healthcare providers and staff in an organization. And these beliefs and values and norms determine the behaviors that are rewarded, supported, expected, and accepted within an organization as they relate to patient safety. We want to note that culture exists at multiple levels. A unit level can have its own culture, as well as a department, an organization, or a healthcare system. Next slide, please. Here are some reasons to use a SOPS survey. They were developed with extensive input from experts and healthcare professionals to make sure they ask about the most important aspects of patient safety culture and are relevant to the healthcare setting. The surveys were comprehensively tested so that they will reliably assess clinician and staff perceptions in an organization. Our SOPS databases contain survey data that is voluntarily submitted by other healthcare organizations. So you can use the data to compare your results to others. And I just want to assure you that all of the information that you would receive to compare your results to others, it's all de-identified. There's no identifiable publicly reported data. The SOPS surveys are actionable. You can use your survey results to identify strengths and opportunities to improve patient safety culture. And as I mentioned earlier, we provide free technical assistance and resources. My next slide, please. So here are some things you can use the SOPS surveys to do. You can assess current status of patient safety culture in your organization. You can raise staff awareness about patient safety. You can identify strengths and areas for improvement, as we've discussed. You can examine trends in patient safety culture over time, and you can evaluate the cultural impact of patient safety initiatives and interventions. And I just want to, before I turn the presentation over to Joanne, I just want to say to successfully use the SOPS surveys, it's really important to make sure that you use survey best methods and to try to obtain high response rates to ensure that the survey results sufficiently represent the views of the providers and staff in your organization. So I'm going to hand this off to Joanne, who is going to talk to you about the best practices for administering a SOPS survey. Thank you again. Joanne?
Thanks, Karen. So as she said, I'm going to be talking about best practices for administering the SOPS surveys. And hopefully you'll get some tips and some pointers to help you administer the surveys within your organizations. Next slide, please. So when thinking about assessing patient safety culture, you first need to decide, which of the SOPS surveys or supplemental items should you use. So there are 5 SOPS surveys to choose from, and each assesses aspects of patient safety culture, such as teamwork, communication, management support for patient safety, etc. And while each of the SOPS surveys assesses similar aspects of patient safety culture, the survey items are customized and tailored for each setting. There are also 6 SOPS supplemental item sets that assess additional areas of patient safety culture beyond those that are included in the core surveys. So the supplemental item sets assess health information technology and patient safety, workforce safety for providers and staff, value and efficiency, and waste reduction, and diagnostic safety. And we're currently developing a supplemental item set on workplace safety for providers and staff in medical offices. In addition, we're developing a version 2.0 of the medical office survey and the nursing home survey. Both 2.0 surveys will be shorter with fewer survey items because we know this is something that users have asked about, and we want to encourage the use of the supplemental item sets as well. We will be pilot testing the medical office version 2.0 and the nursing home version 2.0. And so please let us know if your organization is interested in participating as a site for either of these pilot tests. And you can email us at safetyculturesurveys@westat.com. Next slide. So once you've identified the SOPS survey that's best for your organization, you can consider customizing your survey. If you want to customize your survey, you can add SOPS supplemental items or custom questions that you develop to the end of the survey just before the background questions. You can also modify the work areas or staff positions that are included in the SOPS surveys so they better align with the names of the units and departments and staff positions that you have within your organization. But if you plan to submit your data to the SOPS databases, you'll need to crosswalk your modified units and work areas or staff positions back to the original SOPS survey categories before you submit your data. Next slide. Now I'm going to dive into survey administration. I'm going to go over some of the highlights of what's included in the SOPS survey users guides, which provide details about survey administration, including selecting your survey population, administering the survey, and analyzing the data. The SOPS survey user guides are available on the ARC-SOPS website, and there's a specific user's guide for each SOPS survey. And they have lots of information to help you plan your survey administration. The user's guides provide guidelines that you're going to want to consider whether you plan to administer the survey in-house within your organization, or if you plan to hire an outside organization or vendor. Next slide. So let's go over selecting your survey population and a couple of questions that you need to consider. Next slide. So one of the first decisions is, who should you survey? Now, the fundamental guidance that we provide is that anyone who's asked to complete a SOPS survey should be very familiar with your organization and how things are done so that they can provide informed answers to the survey questions. You'll want to include full-time, part-time, temporary, and float staff. And typically you want providers and staff who've worked in your organization for at least 6 months. You'll also want to make sure you include physicians and residents. Don't forget them. You can include temporary staff, contractors, volunteers, or float staff if they meet the criteria that I just mentioned. So do they know the day-to-day activities in your organization? Do they interact regularly with providers and staff in your organization? Then you'll have this question about some of these atypical or non-clinical areas in your organization. And you're going to need to carefully consider whether to administer a SOPS survey to those areas at all. You don't want to include staff who have to answer, does not apply or don't know to almost all the survey questions, right? That's not going to be helpful. If the survey doesn't apply to some of these areas, we just recommend not administering the survey in those areas. So for example, if your healthcare organization, let's say, includes a health plan, and you have health plan employees, or you have academic departments that don't provide patient care, we really wouldn't recommend administering a SOPS survey to those staff without checking on the applicability of the items to the staff in those areas. So to check, if you have an area and you're not sure if the survey really will resonate in that area, will apply to the staff in that area, then you can go ahead and take the survey, give it to some staff who work in those areas, and then, sit down with them, interview them, ask them to interpret the questions and say, how do they understand the question and how would they arrive at an answer? So there are some questions on the survey, for example, on the hospital survey, there's a question that's, there's a problem with disrespectful behavior by those working in this unit. Now that kind of question could apply almost anywhere to any work setting. but maybe the term unit seems a little bit out of place for some of your areas. But another question on the hospital survey, staff in this unit work longer hours than is best for patient care. That question could be more problematic. So for staff who don't provide patient care or aren't in a patient care setting, how are they going to answer that question? Would they answer about the extent to which they're just working long hours or working overtime, regardless of how it affects patient care? So while it might be easy to just say, hey, we're going to give the SOPS survey to everyone in our organization, you do have to think about those areas where it might not really apply, and make sure that you're not administering the survey in those areas. Because if the staff are interpreting the questions in a different way than intended, then the results are not going to be valid or comparable, and you really don't want to do that. Next slide. Another decision is whether to survey everyone or select a sample. What we find is that most healthcare organizations administer the survey to all their providers and staff to raise awareness about patient safety culture and make sure everyone's voice is heard. However, keep in mind the caveats that I just spoke about on the previous slide about some of these tangential areas that aren't patient care. If you administer the survey in a smaller site, a smaller organization with fewer staff, you should probably consider just doing a census and surveying all the providers and staff in your organization to make sure you receive an adequate number of responses. If your site is large, you can consider selecting a sample to reduce burden on staff and resources, particularly for paper surveys. So selecting a sample would mean surveying only a subset of the providers and staff rather than everyone. And a sample could include only some of the work areas or units, or only some staff positions, or some combination of work areas and staff positions. But you want to make sure that that sample still sufficiently represents the cross sections of areas and staff positions that you have within your organization. If the goal of conducting the survey is to evaluate the impact of a patient safety initiative or an improvement program, you can survey only the providers and staff involved in that initiative, and you can survey them before and after. So that's another consideration, is what's the purpose of conducting the survey. Next slide, please. Next, we're going to talk about administering the survey. Next slide. Larger health systems or organizations might have the capacity and resources to administer the survey, analyze the results, and distribute the survey results on their own. If you administer the survey in-house, make sure you're using the complete SOPS trademarked survey without edits or deletions, because that's going to enable you to submit your data to the SOPS databases and compare your results in a valid way with other organizations. However, your organization may want to use an outside company or vendor to handle some or all of the data collection, analysis, and your reporting needs. Using an outside company for data collection can enable staff to feel more comfortable that their responses are confidential. Vendors may also have more experience and can sometimes do the work faster or with higher data quality than your organization might be able to do. Now, before you hire a vendor, you can shop around and provide vendors with your requirements and then request bids from them. But you'll want to ensure that the vendor uses the official SOPS trademarked survey without edits or deletions, again, so you can have your data accepted into the databases and then enable that comparison to be done validly. And then you want to also make sure that they can accommodate any custom requests you have. So if you want to add custom questions toward the end of the survey or add a supplemental item set, you want to make sure that they can do that for you. Next slide. The next decision is whether to administer a confidential or anonymous survey. And it's not usually an issue either way, but sometimes if an organization's ownership has recently changed or there have been layoffs, and there are trust issues, then the way the survey is administered could make a difference in staff participation. So a confidential survey is when respondents can be identified by the vendor or survey administrator, but there are assurances and processes in place to make sure that identifiable data or results will not be released. The key here is that the entity that's conducting the survey knows who's being asked to complete the survey and who's responding, but they don't share that information. They keep it confidential and only use it for the purposes of administering the survey and analyzing the data. At no point would any individual's responses be identified or linked to them by name with either of these methods. An anonymous survey is when you administer the survey in a way that respondents can't be identified at all. So for example, if you create a web survey and post a link to that web survey on your organization's intranet website, or you advertise a link on flyers throughout the organization, and everyone's using the same web link, not individually customized links, then you wouldn't really know who completed the survey. You would just know basic information that they would provide in the survey when they answer about their work area or staff position. So for a confidential survey, you can track individual respondents to send reminders to only the non-respondents, which can be helpful. So you're not bothering everybody and asking them to complete the survey when they already have. And then you can analyze the results through administrative data that you might have. You might have additional information affiliated with the individuals, and you want to link to those data. But staff may not feel comfortable completing the survey if their responses are linked. And again, that's usually only in the case if there are some kind of trust issues going on. And so that's not typically a concern. In an anonymous survey, again, you're not able to track respondents. And so when you send a thank you or a reminder, you have to send it to everyone saying, if you have already completed the survey, sorry for bothering you. You don't need to complete it again. And if you haven't, to please complete it. And as we said, staff may feel more comfortable if they know their surveys cannot be identified at all. But no matter how you do it, you'll want to clearly communicate whether your survey will be anonymous or confidential in any pre-notification communications before survey administration begins and in the instructions section of your survey, so everyone understands how their data will be collected and used. Next slide. So the next decision that you'll need to make is how to administer your survey. What mode are you going to use? Web, paper, or a combination of both? And once you decide on the mode, you can administer it in-house or hire a vendor to do it with the mode or modes you've chosen. So when deciding on which mode is best, consider your organization's experience with prior surveys. So if you've had success surveying providers and staff using web surveys and achieved high response rates, then you can go ahead and administer a web survey because it'll offer several advantages. Number one, the logistics are easier. There's nothing to print, no survey packets to assemble and distribute and collect, and responses are electronic, so there's no need for manual data entry. The task of data cleaning is also minimized because only valid answers are allowed in web surveys. You can also collect the data on a faster timeline and receive responses faster because they come in immediately. For a web survey to be successful, however, you do need to have email addresses for all providers and staff, and everyone needs access to a computer or device to open their email and complete the survey. Now, you can administer a web survey, again, with just promoting a single link, and it's the same link for everyone. You don't necessarily have to have email addresses, but having an email address enables you to directly provide that link to each individual, and you'll probably have a higher response rate because all they have to do is click on that link in the email as opposed to typing in a URL or scanning in a QR code. In small organizations like some medical offices or in sites where staff don't typically use email, the logistics of administering paper surveys may be more manageable. If your organization usually administers paper surveys, then it might be better to continue with that data collection method. And finally, there may be some staff who don't normally work on computers. And so if you do a web survey, you'll need to provide access to a group of computers for staff who need to complete the web survey. Or you can provide a limited number of paper surveys for those staff and do some combination of web and paper. And then once those paper surveys are completed, you can data enter that data into the web survey. Next slide. So another consideration when deciding which mode to use is how modes affect response rates. So this slide shows the average response rates from organizations that have submitted to the most recent SOPS databases. So as shown in the top row, more than 90% of hospitals, medical offices, and ambulatory surgery centers that submit to the SOPS databases administered the SOPS survey as a web survey, while only 37% of nursing homes used a web survey. However, notice that for all sites except for hospitals, the paper response rates are actually much higher compared to web response rates, or when both web and paper modes are used. So if you look at the medical office column, 94% of the medical offices that submitted to the SOPS database administered using a web survey. And the average response rate of those offices was 58%. But for the number of offices that did do paper, their response rate was 72%. And then overall, if they did web and paper, then it was at 52%. So again, you want to think about what works best in your site and what will also yield a high response rate given the resources that you have. But one caveat about this response rate information is that sites that submit to the SOPS databases provide their response rate denominators, and some sites may not accurately report the number of surveys that they actually administered or distributed. So these data might not be completely accurate, and they're self-reported. So overall, it's best to consider all of these things: your staffing, your resources, experience with different survey modes, and access to emails and computers when ultimately deciding which mode is best for your organization. Next slide, please. If you decide to administer a web survey, again, either in-house or have a vendor do it, make sure that you test the web survey ahead of time. Test the links, the hyperlinks, to make sure that they work and that the survey is formatted to work on a computer or cell phone or a tablet, so that it works on different types of web browsers, because the last thing you want to do is have a web version that really can't be completed because the formatting is messed up on a particular device or browser. And it's also important to publicize and promote the survey before and during data collection, and we're going to talk more about that. So here are the web survey administration steps. First, you're going to send a pre-notification email, and this announces that the survey will be coming, and it's several days before the launch, so staff will be less likely to ignore or delete the survey invitation email. It's best to include your CEO or president's signature on the survey invitation to indicate the importance of the survey and show top leadership support. If the web survey invitation comes from a vendor, then let your staff know that they're going to get an email from a vendor's email address, so they know it's not spam. And then if the vendor is doing it, then you want to make sure that you test that vendor emails can get through your organization's IT firewall. After the pre-notification, then you'll send the survey invitation email with a hyperlink to the web survey. That hyperlink can be individually customized or not, and then you can include a QR code as well. And you'll send weekly reminder emails for the 3 or 4 weeks, or as long as you keep the web survey open. And then finally, you'll produce weekly response rates and weekly reports of response rates for each department or unit, and share those with the unit managers so they know how much additional encouragement they need to do to maximize their response rates. And the survey users guides, again, will provide helpful tips and sample language that you can use in these communications. And so make sure you check those out. Next slide. If you're doing a paper survey, then the steps are very similar, but you're going to have to figure out how to distribute the paper surveys. Are you going to put them through interoffice mail? Are you going to mail them? Do you have to mail them to remote workers? And then how are the completed surveys to be returned? Are there going to be drop-off boxes? Do they need to be mailed back? So lots of considerations there. Again, you're going to want to publicize and promote the survey. And similar to the web steps, there's a pre-notification letter that will go out first to tell them that a survey is coming. And then you'll have a first survey, printed survey in a packet. And then if there's no response after about 2 weeks, then you'll send a second survey packet. And then you're going to want to, you could follow up with a final reminder or just provide weekly response rates again to the points of contact in your departments and units so they can continue to encourage staff to complete the paper surveys. Next slide. So now let's go over some tips for improving response rates. We know that achieving high response rates is a challenge for everyone these days, but there are some tried and true methods to help maximize response rates. But first of all, why do response rates matter? Response rates are important for data quality and representativeness. So you want your survey results to represent the views of providers and staff in your organization. And if response rates are low, the results may not adequately represent the culture of the organization. If you have a high response rate, you can be more confident that your results accurately reflect the views of providers and staff. And so your goal should be to obtain the highest response rates possible. There are many ways to increase your survey response rates, but it will require careful planning and effort. So first of all, we can't emphasize enough the importance of active involvement of leadership. So you need to ensure that your leaders actively support the survey effort and that they're vocal and visible in their support by providing resources, including budget, staff, materials, and that they're supporting the survey and encouraging participation throughout data collection. Secondly, promote the survey. So this is one of the most important steps. Develop a campaign to announce the survey through multiple sources like posters, email, newsletters, message boards, flyers, that you post throughout your facility and on your organization's intranet or website. Identify survey champions in the departments if you have a larger organization, and they can promote the survey and encourage participation in their respective areas. And then consider giving staff time to complete the survey during regularly scheduled staff meetings or during work hours. It's also helpful to foster a friendly, competitive spirit of competition across your organization's departments. So throughout data collection, as we said, you want to provide response rates on a weekly basis to the departments, but you can provide those in a list so that you're actually showing every department's response rate, which enables them to compare how they're doing to other departments. And so for some departments that have high response rates, it'll encourage others to step up their efforts, or they can find out what's going on in those other departments and try to do the things that they're doing to get that response rate. And if you're administering the survey in multiple facilities, distribute response rate reports that compare those facilities to one another as well. And finally, it's really great to consider offering individual department or site incentives. Research has shown that survey incentives can increase response rates, sometimes substantially. Now, incentives don't have to be big or expensive, but they should be considered valuable to staff. So you could consider a lottery drawing for prizes, such as gift cards. You can also have prizes for departments with the highest response rates, or above a certain level, say 75%. So every department or unit that has gets a 75% response rate, maybe they get a dessert tray or a breakfast tray, pizza party, or ice cream social. One hospital we know did a web survey, included a screen at the end of the survey after they completed it to print out a meal certificate that staff could use for a free lunch at the cafeteria. So you can be creative and make it fun, but all of these are really great ways to increase your response rates. Next slide. So I'd like to share one health system's response rate success story. This is a 200-bed Midwest hospital that also had some clinics, and they improved their response rate on the SOPS survey from 12% in 2017 to 72% in 2018. So they had a huge improvement. So what did they do? Well, it wasn't just one thing. They implemented a multi-pronged approach that involved placing fluorescent safety vests and safety cones all around their hospitals and clinics. They attached the safety vest to hangers and hung them up all around the hospital and clinics. And on the front of the vest, there were 2 pins. One pin outlined safety improvements that were made in response to the previous year's survey. And the second pin had details about when the current safety culture survey data collection would be. The safety cones were also placed all over, saying, safety doesn't happen by accident, we need your input. And the leadership team walked around to all the areas wearing safety vests, handing out candy and hard hats, encouraging staff to take the survey. In the clinics, they gave staff specific examples of how safety culture applied in their unit to emphasize that safety is important at all levels and units, not just for those who interact directly with patients. And they also sent weekly reminders. So devising a fun and creative way to get staff involved can initiate conversation and help combat staff burnout from surveying. And these strategies were a great way to promote a positive view on safety culture to staff. And as the director of continuous improvement at this hospital said, showing staff how previous survey results were used to make improvements was crucial to getting staff buy-in. By the way, this hospital prided themselves because their budget for the items that they purchased was only $50. And I'm sure they put a lot more effort in terms of the time dedicated, but their actual dollar amount for these materials was very small. So I'm sure some of you out there also have good improvement stories, either improving response rates or implementing initiatives and improving your SOP scores. And we'd love to hear your stories to potentially share with other users. And so you can email us at safetyculturesurveys@westat.com, and we would be happy to follow up with you. Next slide. All right, moving on to analyzing the data. Next slide. I'm not going to go into a lot of detail about how to analyze the data, but for sites that administer the SOPS survey on their own, we have SOPS data entry and analysis tools that you can use to calculate your survey results. There's a tool for each SOPS survey and each SOPS supplemental item set. And the tools are very easy to use. You basically enter in your survey data, or you can copy and paste the data from your web survey output into a data entry sheet, and the tool will automatically calculate and display tables and graphs of your survey results. The tool also compares your site's results to the latest SOPS database and shows breakouts of the data by staff position, work area, etc. The tool uses Microsoft Excel, and so you just have to have macros enabled on your computer to run the program. The tools also have a feature that enables you to export your survey data into a separate Excel spreadsheet, which you can then use to submit your data to the SOPS databases. And you can request a copy of any of the data entry and analysis tools by emailing databases-on-safety-culture@westat.com. Next slide. So when analyzing your survey data, don't forget about the open-ended comments. We typically see about 30% of respondents entering comments, which can amount to a lot of comments if you conduct a census and survey everyone in your organization. One way to manage the analysis of open-ended comments is to read and review only a sample or a subset of the written comments. So you can select them randomly or ensure that you have comments you've selected a sample from all units and staff positions. And then you'll have some analysts code the selected comments into themes and then use direct quotes from the comments to illustrate those themes. So by removing, and you want to make sure that you're removing any identifying details that may be in the comments, like individual names. But we encourage you to analyze the written comments in addition to providing feedback on the numeric survey scores. And you can also drill down and summarize these comments at the unit level or by staff position. Comments illustrate themes that are brought up by the survey and reflect the voices of providers and staff. So they really do resonate when they're shared. And they can also be a great source of specific suggestions for areas to improve and what to focus on for improvement. Note that we don't accept open-ended comments in the SOPS databases, but we definitely recommend that you do some analysis and summary of the comments that you receive from your SOPS surveys. Next slide. So now I'm going to discuss action planning for improvement. Next slide. So you've administered the survey and shared your results. So now what, right? Many organizations, we know this is the point where we're struggling, not only to get a high response rate, but now how do we achieve value and lasting change from the surveys? And the patient safety culture surveys can signal the importance of patient safety, can raise awareness about patient safety, but I caution you that they shouldn't be viewed as the intervention, right? They are assessment tools. Next slide. So I'd like to challenge you to change your perspective on how you view surveys in your organization. This is a quote from Alan Church, who's an industrial organizational psychologist and an expert on using organizational surveys for change. And he said, "The perceived failure of surveys to create lasting change is due to faulty or non-existent action planning or survey follow-up. Delivery of results is not the end of the survey process. It is just the beginning." And so I want to challenge everyone to think about the process of selecting the survey and administering it and achieving high response rates. The whole purpose of all of this is to get data to then inform your improvement efforts, right? So it's the beginning, not the end. So next slide. So you're going to want to share your survey results, right? That's even before you begin action planning. The results have to be shared throughout your organization so that every staff member that took the survey has the opportunity to see the results. A lot of times the survey results go to upper management, department leaders, but fail to reach the individual providers and staff who completed the survey. And so they don't really know what happens with the data. So it's important to make sure that everyone sees the results. The results can be shared and discussed through department or unit meetings or at your organization's patient safety fair, on your intranet website, or shared by email. And again, you can share examples of the written comments in addition to the numeric scores. And so, sometimes those comments have really positive, the providers and staff have really positive things to say. And so it's very motivating for staff to see the positive comments and scores in addition to identifying areas for improvement. Next slide. So you can use the SOPS action planning tool to help you with action planning. You're going to begin by forming a multidisciplinary action planning team. And that's going to consist of members from different roles, positions, skills, and perspectives within your organization. And senior leaders will need to support the action planning process as well. And action plans will begin with identifying areas for improvement, planning an improvement initiative, and then communicating your action plan. And you can complete the SOPS action plan template to document your action plans. So I'm going to dive a little bit deeper into the middle step here on developing action plans over the next couple of slides. Next slide. So since patient safety culture can differ at these multiple levels, the organization, the unit, you want to provide feedback at these various levels. And it's good to do action planning at the department or unit level, in addition to maybe organization-wide. So have the units review and discuss their own survey results, the numeric and the qualitative comments, and have them identify areas they want to focus on for improvement. So by delegating action planning to each unit, it engages the units and holds them accountable for their own improvement efforts. So let's go to the next slide to step 1. The first step in developing action plans is to identify areas to improve. This can be a lot harder than it sounds. So what areas do you want to focus on for improvement? Do you want to focus on the low scoring areas or areas aligned with initiatives your organization's already doing? And if needed, you might consider conducting interviews or focus groups with providers or staff to follow up on the survey results and drive for a deeper understanding of the issues where you need to focus. An important tip is to avoid focusing on too many issues at once. Identify 1, 2, 3 areas for improvement that you think will have the greatest impact. And then what are your SMART goals? You want to create goals that are measurable, that are specific, measurable, achievable, relevant, and then set a time frame for when you want to achieve those goals. Next slide. The second step is to plan your improvement initiatives, asking questions about, what will you implement? What initiatives have been successful in other organizations? What resources do you need, including staffing, materials, maybe training? What are the barriers, and how can you overcome them? How will you measure progress and success, right? Maybe it's the number of staff trained or improvements in measures of patient safety. And then will you pilot test the initiative, right? It's often a good idea to try an improvement initiative in one area before spreading it more broadly through the organization. And then, as we said, make sure your timeline is detailed and is realistic. And next slide. And number 3, you need to think about communicating your action plan. Who needs to review the action plans and offer input? Who needs to approve them and allocate resources? How will you provide progress updates? And how will you do that? Through meetings, emails, flyers, newsletters? Once your pilot test or improvement initiative has been, implemented, communicate the results. Did it work as expected? What worked well, what didn't? And can others implement it in other areas of your organization? And think about how best to share that. Next slide. So this slide just shows the first page of the SOPS action plan template, which can help you document your action plans. This is a fillable PDF that includes space for you to fill in your answers, and the units can fill this out and submit it so that they have it documented and can follow up. Next slide. As you're working on your action plans and identifying areas for improvement, you might find the SOPS Improving Patient Safety resource lists helpful. We have resource lists for every survey setting and supplemental item set, and they contain links to practical resources that are free and publicly available to help improve patient safety culture and patient safety in your organization. Next slide. Finally, just a little bit about submitting to the SOPS databases. Next slide. In 2024, there are 2 SOPS databases that'll be open for data submission: the Hospital 2.0 survey and the SOPS Nursing Home survey. The Hospital 2.0 survey is open in June, and the Nursing Home survey is open in October, and we're accepting supplemental item sets for both of those surveys. Next slide. And again, participation is free, and we provide technical assistance. Participating facilities receive a customized feedback report, and then we also produce a yearly database report that aggregates the results from all of the participating sites. Next slide. Requirements for participation are pretty easy. You have to have administered a SOPS survey in its entirety. And the site has to be located in the US. You sign a data use agreement that specifies how we'll use the data and ensures the confidentiality of the data. And then you'll submit your data files and survey per the specifications through an online data submission system. Next slide. So for all of these resources or questions, we have technical assistance. Our general technical assistance email is safetyculturesurveys@westat.com. And our database technical assistance email is databases-on-safety-culture@westat.com. And all of these resources, the survey users guides, are found on the ARC website at www.ahrq.gov/SOPS. Next slide. And we periodically send email updates through a listserv, and you can sign up on the ARC website by going to the top right corner and selecting email updates associated with the surveys on patient safety culture. Next slide. So now I'm going to turn it over to Lisa to facilitate the Q&A segment.
Thank you so much. Next slide, please. So thanks, Karen, and thanks, Joanne, for your informative presentations today. You've shared a lot of helpful information about the SOPS surveys. As a reminder, you may ask a question through the Q&A feature shown here. Look for the Q&A icon. We encourage you to share your name and or organization or role when you type your question. Speakers will respond to your questions during the Q&A portion of the session. If you joined late, a replay of today's webcast will be made available on the ARC SOPS website. So getting to some of the questions that have come in for Joanne, how do you avoid survey fatigue?
Okay, great question, right? This is one we hear all the time. Because it takes time to plan for the survey, administer the survey, analyze the results, share, develop action plans. Many organizations only conduct the SOPS survey every other year. We know it takes time to achieve culture change, and we did see lower scores after the pandemic, and so many healthcare organizations are struggling to get their scores back to where they were pre-pandemic. But I'd say the biggest contributor to survey fatigue isn't the length of the survey, but if you're surveying too frequently and you haven't demonstrated that you've done anything with the survey results, then people don't want to answer surveys and have the data go into a black hole or think that nothing is being done. So the main thing is to make sure that you promote, as that one hospital that had really good success said, demonstrating that you've done something with the survey data is probably the best way to avoid survey fatigue, because respondents know that their data is important and valued and being used for improvement, and then don't survey too frequently.
Okay, great. Thank you. Next question is for Karen. Are there plans to open the community pharmacy database for data submission?
Oh, I'm really glad you asked that and expressed interest in that database. We haven't been opening it recently because we haven't had enough data submitted to justify opening the database. But if you are interested, drop us a note at databases at her email address, and I'm not recalling it right now, safetyculturesurveys@westat.com. And let us know of your interest and maybe a little bit about where you work, and we'll get back to you. I'll see it as well as the Westat technical assistance folks.
Okay, thank you. The next question is from Ariel Fishman. Is the hospital survey suitable for outpatient and ambulatory practices of hospitals?
Great question. So we do not recommend using the hospital survey for medical practices, outpatient practices. What happens with health systems is that they administer the hospital survey in their hospitals and the medical office survey in their outpatient clinics. And if you have an ambulatory surgery center that's affiliated, you can use the ASC or ambulatory surgery center survey as well. So we don't recommend just using the hospital survey in the medical office or ASC settings.
Okay. Um, our organization has considered if we could administer the survey longer than the recommended 2-week period, or does that affect validity of the survey, especially for a larger network or health system?
Absolutely. You can field the survey as long as you need, right? If you're a small organization, then maybe you don't need as much time. But depending on how you're administering the survey, and if you have thousands of providers and staff, then yes, you can field the survey for longer. You can field it for 4 or 6 weeks. It doesn't really affect the validity. The thing that affects the validity is probably having a low response rate. So if you can extend the data collection period and increase your response rate, then that's going to be beneficial.
Okay. So if we don't submit data, will we still have comparison to the database and result of the surveys, correct?
So if you submit to the database, which I really encourage you to do, it's not hard. We will walk you through every step of that process. It does include your data in the overall benchmark, which is helpful. But if you don't submit to the database, but you administer the SOPS trademark survey without any edits or deletions, then you can request the data entry and analysis tool, put your data into the tool, and it will show you the latest comparisons with the most recent database. If you submit to the database, you will get that comparison a little bit earlier than you would if you submit to if you have the data entry analysis tool. It takes us a little while to get that updated.
Okay. What percentage of the database administers the survey annually?
We actually have seen that most organizations are doing this every 2 years, right? Every other year. For the reasons that I was saying, it takes a while to get through this whole improvement cycle of assessing culture and then developing initiatives to try to improve and then reassessing. If you're using the survey to evaluate the effects of an intervention, then that would be a shorter time frame, but it would be focused on only those staff involved in the intervention. And because we know that hospitals and healthcare organizations, medical offices are taking longer to get through these cycles, the ARC-SOPS databases are only open every other year to accept data. So the hospital database is opening in 2024, and it won't open again until 2026. But we do intake any data that has been administered over that 2-year period.
Okay. Are there any recommended targets or goals for response rates?
Well, it's always good to set the bar higher than whatever you had the previous year, right? But I would say we look to try to achieve a minimum of 50%. But if you get to 60 or 75%, that's even better. So yeah, I would say you want to shoot for at least 50%. And then if you get a higher response rate, it's just better. It's more representative, hopefully, of the providers and staff in your organization.
Okay. And we're coming to the top of the hour, so maybe one more question. What are the most common barriers when the healthcare workers don't accept to participate in the surveys?
Well, that really depends on your organization, right? I would say the most common barrier is not doing anything with the survey results, right? We were saying that you think about administering a survey as the first part of a process of improvement. And so if staff are providing this input and nothing's being done with it, then it's very demotivating for them in the future to continue to do that. So again, publicizing, kind of like that example site, making it fun, offering incentives, doing all of those things to increase response rates should help.
Great. Well, thank you. Thank you,
Excuse me,
Joanne
Lisa?
and to Karen.
Lisa, there's one more question. I just want to, that came in and just came in, and I think we should
Okay.
answer it. It's, is there any documentation I can bring to leadership to express benefits to submitting to the database? That's a great question. Go to our chart books. They're on our website. Look for each survey. And in the first 2 pages of our chart books is a tear out with a summary, a beautiful summary of findings from the database. And I think that they speak for themselves, and they were designed specifically to take to leadership to give a summary of the kinds of information that we collect. So I'm going to urge you to look for that. And if you can't find it, write to us.
Okay, great point, Karen. Okay, so we are at the top of the hour. Next slide, please. So a brief webcast evaluation will pop up when you close out from today's webcast. Please take a moment to provide us with your feedback, as it helps us to improve our offerings and plan future events that meet your needs. Thanks so much for joining us. This concludes today's presentation.